Okay. Thanks to everybody who just joined. Welcome. All right, so I think we'll get started. Hello, everybody, and welcome to today's session. I'm Diane Coraggio, the Chief of Staff at the Lerner Center for Public Health Advocacy. Thank you for taking the time to join us today. This is a very important discussion, and we're looking forward to talking about the FDA's proposed rule to ban menthol cigarettes and flavored cigars. So thank you for being here. The Lerner Center for Public Health Advocacy is hosting this webinar with the Institute for Global Tobacco Control as a way to empower the public health community to strategically engage in the FDA's public comment period. The public comment period is an important advocacy tool for all of us, public health professionals, researchers, and advocates, as a way to participate in the policy conversation and influence the regulatory process. So we hope that you'll leave this webinar today with a better understanding of the potential health impact of the proposed rules, the equity implications for communities of color, and strategies for making the most of your public comments. Today's session will be recorded and it will be available on our website in the coming days. And we'll also be sharing in the chat a few resources related to today's conversation. So if you could just go ahead and drop any questions in the chat, we'll get to as many of those as we can at the end during the question and answer. So each panelist will have about 15 minutes to make a few remarks, and then we will have time at the end for question and answer. So with that, I'd like to introduce our three panelists. We're very excited to have them. So we'll start with Joanna Cohen. Joanna is a Bloomberg professor of disease prevention and director of the Institute for Global Tobacco Control at the Johns Hopkins Bloomberg School of Public Health. Joanna has been involved in tobacco policy research for over 25 years. Trained in epidemiology and health policy, her research focuses on factors that affect the adoption and implementation of public health policies and on evaluating their beneficial effects and the unintended consequences. Dr. Cohen is also the deputy editor of the journal Tobacco Control. Thank you, Joanna. We're glad to have you. Carol McGruder is a founding member and co-chairperson of the African American Tobacco Control Leadership Council. Created to inform the direction of tobacco control policy, practices, and priorities, the Leadership Council works at the intersection of public health policy and social injustice. Carol served as NAACP branch president for Berkeley, California for 2 terms. She received the prestigious Biddy Mason Unsung Shero Award in 2021. I love that. Carol also serves as the project director for 2 statewide California tobacco control projects that focus on the African American and Black community. And Carol will speak a little bit about this, but I just wanted to make a quick note that in 2020, the Leadership Council, the Action on Smoking and Health, and the American Medical Association and the National Medical Association filed an administrative lawsuit against the Food and Drug Administration for its failure to take mentholated tobacco products off the market. The lawsuit prompted the FDA to begin the rulemaking process, which we're here talking about today. So Carol will say quite a bit more about that. So thank you for being here, Carol. Very excited to have you. And last but not least, we have Matthew Wellington. Matthew Wellington is the Public Health Campaigns Director at the U.S. Public Interest Research Group. Matthew spearheads PIRG's public health campaigns, which include COVID-19 response efforts. Oh, there's Matt. Sorry, Carol, I didn't use your slide. This is Carol. And Matt's campaigns include COVID-19 response efforts, as well as campaigns to keep children from becoming hooked on tobacco and to end the overuse of antibiotics in our food system. In his 8 years with PIRG, he helped pass policies and win corporate commitments to protect public health across several issues. Matthew is also a regular contributor to major news outlets and has been featured in NBC Nightly News, The Wall Street Journal, CNN, and more. So thank you to all 3 of our panelists. We are very excited to have you. And again, we will be sharing some resources in the chat for anybody who just joined. Welcome. And we will start with Joanna. So Joanna, if you want to take us away, I will stop sharing my screen.
Great, thank you. Thanks to for the collaboration with the Center for Public Health Advocacy for this webinar. So let me just share my screen. All right. Great. Well, I'm really pleased to be here, and I'm just going to start us off with a little bit of background to set the stage for our other terrific speakers. So we're here to discuss the FDA's proposed rule on menthol cigarettes and flavored cigars. And so in other words, we're sort of here to finish the job. So what job was started? Well, in 2009, the Tobacco Act, which was signed into law by President Obama, banned cigarettes with characterizing flavors except menthol and tobacco flavors. So it just the law did a number of things and gave the FDA authority to regulate tobacco products, but flavors in cigarettes were banned with an exemption from menthol, and the flavor ban did not apply to any cigars or other tobacco products. So it's been a long road. So the Tobacco Act was signed in 2009, and now finally in 2022, we have the FDA's proposed rule on menthol. It's taken 13 years, and you'll hear a little bit more about that advocacy process to get us to where we are today. So just some international background, because I'm at the Institute for Global Tobacco Control. Will we be the first country to ban menthol in cigarettes and flavors in cigars? No. So I'll just give you, just so you have a sense of what other countries are doing. So in 2009, Canada banned flavors in little cigars. They were also banned in they're banned in cigarettes as well, but flavors in little cigars were banned in 2009. Then in 2015, Canada banned non-menthol flavors in sort of larger cigars of different weights, because of course, when you ban the flavors in the little cigars, then the flavors proliferate in the larger cigars. Between 2015 and 2016, some countries in Africa, Ethiopia, Uganda, and Senegal banned all flavors in tobacco leaf products. So technically that's all tobacco products. And then in 2018, or by 2018, all Canadian provinces had banned menthol cigarettes. So it sort of went province by province, and by 2018, the whole country was covered. And then in 2020, we saw the implementation of the cigarette menthol ban in the European Union, including the UK. So we will not be the first. So why do we care about menthol in cigarettes? So menthol produces a minty taste and a cooling sensation when you inhale it. And that also reduces the irritation and harshness of smoking. So it makes it easier to inhale smoke, which is generally pretty harsh to inhale. So it helps anesthetize a little bit, remove the irritation from breathing in smoke. It's also important to note that menthol interacts with nicotine to enhance nicotine's addictive effects in the brain. And thus, with all of these effects, nicotine plays a really important role in creating and perpetuating tobacco-related health disparities. Now, what about flavors in cigars? Again, flavors in cigars help increase the appeal of the product. They make cigars easier to use for new users. And because of this, they promote youth initiation of these products and result in a higher likelihood that youth and young adults who experiment with flavored cigars will eventually progress to regular cigar smoking and will use other tobacco products. So let's just jump into the FDA's proposed rule. So regarding menthol cigarettes, what does the proposed rule lay out? Well, it would prohibit the use of menthol as a characterizing flavor in cigarettes and cigarette components and parts. And that includes in the tobacco, in the filter, in the wrapper, and paper. And further, a cigarette or any of its component parts should not contain as a constituent, including as a smoke constituent, so either before it's burned or as part of the burning process, or shall not contain as an additive, menthol that is a characterizing flavor of the tobacco product or tobacco smoke. The rule also covers menthol flavoring that is separate from the cigarette. So for example, menthol drops that you can add to the cigarettes, menthol capsules that you can insert, mentholated filter tips for roll your own tobacco, or menthol cards that you can put into a cigarette pack or pouch of rolling tobacco, because all of these are considered components or parts of cigarettes. And this is part of the rule because we've seen in countries that have not addressed these accessories in their laws and regulations, that these types of accessories have proliferated and people start using them, so that the ban on menthol has a lesser effect because there are other ways to add menthol to your products. So the rule also states that no person can manufacture, distribute, sell, or offer for distribution or sale within the United States a cigarette or cigarette component or part that is not in compliance with the product standard. And there is some finer print saying that these products can be produced for export. Now, let me just point out, I mentioned characterizing flavor. So I just want to say a little bit about how the FDA is thinking about mentholated, characterizing flavors. And this gets a little confusing, but it's really important, again, when you start to think about how the law is going to be actually implemented in practice. So this is what the FDA says about determining if there's a characterizing flavor. So they say the presence and amount of artificial or natural flavor additives, compounds, constituents, or ingredients, or any other flavoring ingredient in a tobacco product, including its components or parts, so it can't be in it. But also they're suggesting to take into account the multisensory experience. So for example, the taste, aroma, and cooling or burning sensations in the mouth or throat when the product is used. And then also they also are talking about addressing flavor representations, including descriptors or words on packages that are either explicit or implicit on the packaging, and including on the advertising as part of the advertising of a tobacco product. And they're also proposing that they would include any other means that impart flavor or represent that a tobacco product has a characterizing flavor. So again, this is here to try and address some of the limitations and challenges that we've learned from what other countries have done and loopholes that have been left open for the industry to take advantage of. Let me just see, I think I may have, let me just go back to this, the proposed rule on flavored cigars, because this is also really important. The menthol ban in cigarettes is key, but also the proposal for removing flavors from cigars. So the proposed rule would prohibit characterizing flavors other than the tobacco in all cigars and their components and parts. We've talked about that already. It would prohibit the manufacture, distribution, sale, or offering for distribution or sale within the US, these products. And again, they're allowed to be exported. And the rule says that these products shall not contain as a constituent, including a smoke constituent or additive, an artificial or natural flavor other than tobacco, or an herb or spice, including but not limited to strawberry, grape, orange, and it keeps going, including menthol, that is a characterizing flavor of the tobacco product or tobacco smoke. So I know this is pretty heavy, but these are some of the important pieces that are in the rule that you might want to be commenting on. So I'm just sort of exposing you to some of the comments or the content of what's being proposed. So just a couple slides on the FDA, how FDA sees the expected impact of the ban on menthol in cigarettes. So in 2019, over 18.5 million current smokers of menthol cigarettes, or in 2019, there were more than 18.5 million smokers of menthol cigarettes, age 12 and older in the US. So this would impact all those folks, and hopefully the idea is to get them off of tobacco products when their preferred product is not available on the market anymore. They're expecting an estimated 15% reduction in smoking prevalence within 40 years if menthol cigarettes are no longer available. And there's some estimates of how many hundreds of thousands smoking attributable deaths there would be overall in the US and among African Americans that would be avoided within 40 years. And these are based on modeling studies as well as data, particularly from Canada as well, where the menthol ban has been implemented. And the public health benefit is expected to be especially pronounced among youth and young adults, as well as Black smokers who have the highest prevalence of menthol cigarette smoking and who experience a disproportionate burden of the related harms. And then what about the expected impact of flavored cigars, of removing flavors from cigars? So currently the estimate is that there's about 9,000 premature deaths each and every year that are attributed to smoking cigars for folks who smoke at least half of the month. In 2019, more young adults tried a cigar for the first time than tried a cigarette for the first time. So again, hoping to avoid that initiation. In 2020, an estimated 3.5% of middle and high school students had smoked a cigar, cigarillo, or a little cigar in the past 30 days, and that's almost 1 million middle and high school students. And more than half of youth cigar smokers, representing over 500,000 youth, reported using a flavored cigar in the past 30 days. So there's a lot of use in these products, particularly among populations who are already at experiencing disproportionate burden. So just to wrap up, the tobacco industry is always circumnavigating loopholes in policies. And we've learned from what has happened in other countries how they do that with respect to flavor bans. And so again, we want to make sure that in the US, our proposed rules do not allow for loopholes. So what have companies done? They have used color packaging to try and denote flavors. So colored the packages differently. They've used concept descriptors to denote a taste, smell, or sensation of the product inside. So they've used words like purple blast or Arctic air. And this is why the definition of characterizing flavor is so important. Is purple blast a characterizing flavor? Would it be considered that? This is where the details get important. And we've also seen in other countries and in this country as well, if not all tobacco products are covered by a flavor ban, the tobacco industry markets other tobacco products with flavors. And in our case, it might be e-cigarettes or vapes and even heated tobacco products. So just last slide, it's essential that tobacco product flavor bans are comprehensive with no loopholes, that the implementation is swift, so the companies don't have time to introduce other products that might entice people, and we have to make sure that enforcement is strong. So thank you, and I'm going to pass it on to our next speaker.
Thank you, Joanna. That was great. Really, really informative and very helpful. So up next, we have Carol. And before Carol speaks, I just want to let everybody know, between speakers, we will be dropping our resource links in the chat. So keep an eye out for those. And I will pass it to you, Carol.
Okay, can everyone hear me? Give me a thumbs up. Okay, and you can see my slides, hopefully. So good morning, good afternoon. I'm in California, so I'm I'm still in the morning. It's my pleasure to speak with you all today about this very important issue. I am the very proud co-chair of this organization, the African American Tobacco Control Leadership Council, and we have really been at the forefront of the movement to get mentholated tobacco products off of the market. And this is, we declared that this was our year of no menthol, and it's moving so fast that we can't keep up. We're just struggling to keep up with all of the wonderful things that are happening this year around getting menthol and flavored tobacco products and little cigars and cigarillos off the market. So what I'm going to do today is I'm going to share our African American tobacco policy platform, which is a tool that we've developed that you can use in the work that you do to give your work a little more weight. They're often not African American commercial tobacco control advocates in spots all over the country, and that's one of the voids we've been trying to fill in many ways. And so this policy platform was really developed to speak to African Americans about tobacco, and then it has just grown in its use. So I thought I would just kind of freshen up my presentation and use this as the platform. Last week, June 1st, the city of Los Angeles became the largest city, and I believe LA is our second largest city in the US, to vote 12-0 to pass a law to take menthol and flavored tobacco products off the market. So this was a huge, huge win, long fought for. We started this process before COVID, and of course that disrupted everything. And Los Angeles is not a microcosm. I need help with that because it's a cosm of the struggles that we face as African Americans in trying to pass laws to protect Black people. And I'm glad that Joanna gave international context to the menthol issue, because the countries that have moved to take menthol off the market, Canada, the European Union, there was no discussion of racism, of Black folks, of what Black people want, what we need in terms of our tobacco needs, because the racial overlay of everything in our country is just so heavy and pervasive. And what should be just strictly a discussion about health and what would improve the health of people is politicized and racialized, as is most things are, unfortunately, in the United States. So we're dealing with that legacy. So with Los Angeles, there I am. We had a big press conference, and very happy and proud. And I am a Californian, but I grew up one foot in Los Angeles and one foot in the San Francisco Bay Area. So very much aware of the police brutality, the racism that Black people have really faced in a very particular way in the Los Angeles area. And so this was a huge win for us, and we had to overcome the racism and police brutality that we have endured there for these decades. So there's some of our team, very happy, as you can see, and it was a very emotional day for me. But I want to put this in the context of our community. And this is really pertains as well to Baltimore. We actually were working in Baltimore right before the Freddie Gray incident. And I was actually in Baltimore when that happened, or right before, because we were coming. The Baltimore City Council had voted to take menthol off the market, and Maryland is a preemption state, so it was more symbolic than something that was actually going to happen, because it has to come from Annapolis in Maryland, and that's something that we're fighting. But this is a picture of Los Angeles when I was a child. The Watts riots happened, and we lived on a hill, and I remember watching the plumes of smoke coming up from Watts, which was a distance away from us. But the fear and the understanding that I had as a child of seeing these images on television, and the police were just so vicious. And so, and I want to say this because the police brutality touched every Black person in Los Angeles. My father was an engineer, a businessman, and he was given a ticket in Los Angeles for driving too slow. I have an uncle who saw a man chase another man down the street and shoot him in the back, and he reported it. And that person who shot the person in the back was a police officer. And he was pressured to change his story, his testimony, when he was just being a good citizen calling in this horrific incident that he saw. So this shaped my life as a young adult. When I would drive down to visit my family, I would always see some incident of police brutality. And so the tobacco industry, so this is Rodney King. I was actually living in France during the whole Rodney King incident. So I saw this beating on television, and the aftermath of it happened right before I came back to the US. I was in Paris, and some friends said, something's happening in your country. Turn on the TV and see all of the cities in the United States that were going up in smoke in protest against the 4 police officers being acquitted after they had viciously beat this man on video. And that, we saw that then with George Floyd with a different outcome. But that's the backdrop that the tobacco industry is using to defend itself and to say that we have to keep mentholated tobacco products on the market for Black people, because if we don't, they're just going to lose their minds, and they're going to have Black markets smuggling and a mafia type element, when the mafia is the tobacco industry, who are federally adjudicated racketeers under RICO, which is the Racketeering Influence Corrupt Organizations. And they're the ones that need to be stopped and need to be prevented from selling a product that kills 45,000 Black people every year in this country. And that's what we're about. That's what we're fighting. So we've had some great help in this past year, because there was a wonderful LA Times article that talked about how the industry continues to buy Black leaders to carry their water and espouse their rhetoric about taking these deadly products off the market, what that's going to do to our community. So Joanna covered this. President Obama signed a smoking act. It was generally accepted that flavors hook children. This was before vaping, and that practical demonstration for all of us of the power of flavors and enticing children to smoke and then become addicted to the nicotine. But the exclusion of menthol, we call it the original sin, was not based on science. It was a negotiation. And at that time, we came to the forefront of this movement because there just wasn't anybody else there nationally. We had no funding, by the way, in those beginning days. I was going back to these FDA meetings, to the TIPSAT meetings on my own money, because there was no representation for African Americans or other people of color. So that begged the question of who would protect Black children. These are Head Start babies, by definition, low income, exposed to secondhand smoke at high rates. Who would protect these babies? Who would protect our children, our adolescents, who grow up like everyone else's kids, who are tempted by the lure of the media and the really racist and pernicious targeting, which is heavier in our community than others? There was no one protecting them. And so that is the question that we put before all of us, is that our children need protecting, that Newport smokers aren't born adults with the Newport in their mouth. They go through the stages of life like everyone else. And we have so many minefields to get through. If all children do, more and more, from gun shootings to, we have all these minefields, physical, psychological, mental, to get through to become an adult. And so in the Black community, there are just so many more mines that people have to navigate in order to hope to have a decent, productive life on the other end that's free of addictions and violence and et cetera, et cetera. So this is one of our babies that the retailers will say that, it's bad parenting that make our children take up smoking. So with vaping, we saw that it's not about parenting, it's about a lot of other social communal norms that are happening. And so our position is that this boy, he needs more protection than others, because you can look at him and see that he's probably had a challenging life. And so it's up to society to protect him. So we called that exclusion of menthol, the exemption, trickle-down public health policy, where, you make it good for people at the top who can kind of defend themselves. And then hopefully some of it is going to trickle down to the people that really need it. So this is an abstract we submitted. We were taken our case out of the US early on. This is 2012. You know, it's hard when I look at these numbers now, we're in 2022. So this is 10 years ago. The least of these US tobacco control policy, mentholated cigarettes and African Americans. So this documents just that pernicious targeting by all major tobacco companies, their urban programs that included the co-optation of Black leaders, heavy media campaigns, free giveaways to children, the retailer programs, event sponsorship. And because of that, over 80% of African Americans who smoke mentholated tobacco products. 90% of youth initiate with menthol cigarettes. And that addiction is about science and opportunity. And that for us, this is a human rights and it's a social justice issue as much as it is a public health issue. And so this is our poster girl for these giveaways. This is Marie Evans, who was given free cigarettes in Boston at the age of 9, addicted at 13, dead at 54. Her family actually sued and they actually received a settlement of $79 million. So this woman, if she were alive, she would be my age. And so I think about that. If I wasn't here, the impact that that would have on my family, all of the people that count on me, my community, the community work that I do. So the industry is robbing African Americans of our adults, our parents and our grandparents, who are the stabilizers of our community. And so we get caught up on, which is very painful, a Freddie Gray, an Oscar Grant, a George Floyd, but there are 8 other adults in the back being murdered and being seduced by these products that destabilize our community. And that's what we are focusing on. So African Americans, we're used as a tool to blunt public health policy for us, but for everyone else as well, because we all live together. African Americans are certainly not the only people that smoke menthol products, but it's just the vast majority do because of that pernicious targeting. So this is a wonderful LA Times article, how big tobacco used George Floyd and Eric Gardner to stoke fears among Black smokers. So this is the industry latching onto those photos that I showed at the beginning of my presentation to say, no, these products need to stay on. We simply need more education. Don't take the products off. And I laugh because there are a lot of things that we want and that we need as African Americans. So let's start with justice and police reform and housing and education, and then get to the menthol cigarettes. If you want to do something, the industry wants to do something for Black people and what we need and what we want. So this is the most recent research that was done with Mendez and Lee, documenting from 80 to 2018, the consequences of a match made in hell, the harm caused by menthol smoking to African Americans. And it quantifies the loss of how many more African American smokers we have, how many more smoking related deaths we've had, and the life years lost. And so this is a wonderful research paper that can be used as well, that's recent, because a lot of our data, as you know, it trails behind. It's not recent and current. So this was a wonderful research, and they're going to be speaking. We're doing a plenary for those of you who might be coming to NCTOH at the end of this month. We're doing a plenary on this research paper. So the industry latches on to our legitimate concerns and uses that against us to keep these products on the market. And so one of the people that's been at the forefront of this is the Right Reverend Al Sharpton with his organization, National Action Network. They are actively working right now as we speak to bring in particularly ministers to denounce taking menthol off the market. And so we actually have some wonderful information. We'll have some podcasts and media next week about this. We have a minister out of Detroit who's actually going to be talking about how they were trying to reach out to him with quite a substantial sum of money to get him to denounce taking menthol off the market. So Eric Gardner out of New York, allegedly selling Lucy's, who was killed by the police there. He was the catalyst, the spark of the Black Lives Matter, and these incidents, of course, build up. There's a pressure point, and then something happens. So that was, the catalyst for I Can't Breathe, which is so interesting because that's what you can't breathe when you die from tobacco-induced diseases either. So this point of it is that we need to concentrate on really fighting the criminalization, that rhetoric about criminalization, and we need police reform. And so a lot of us in public health are talking about equal enforcement of commercial tobacco control laws, but we need equal enforcement of all laws, and we need police reform. So this is California. We signed a law, the second state after Massachusetts. The tobacco industry collected signatures. It will be as a referendum on the ballot in California in November. And what we're encouraging everyone is to continue to fight locally, in your city, in your county, in your state, as we work with the FDA, and pursue that process at the same time, because tobacco control is a local fight. And that's the pressure that we built all over the country, along with the lawsuit, to get the FDA to move. And I have the policy platform that we have. These slides will be available to you. There are 10 points. And the first one is prohibiting the sale of all flavored tobacco products, including menthol. So we start with menthol. Protect our children, work within our own organizations, because the tobacco industry tries to co-opt them. So we have No Menthol Sunday, we have leadership groups. And this is part of the general community engagement and community capacity building that we need around commercial tobacco control, because it's not about passing a law. That's the beginning of the end. It's not the end. And we need to pay a lot of attention to implementation and providing services to people to get off of these addictive products. So it's not about just pulling these products from the market and then there's nothing there for people, but we also need to have services for people, and to advocate that tobacco taxes are used to help Black smokers and in a real comprehensive way. And I see Diane is on. So we work with elected officials. The beauty of Los Angeles was many of our African-American leaders there who were taking tobacco industry money, they no longer take it. And they voted yes to take menthol off the market in the city of Los Angeles. So that was a huge win and a demonstration that that work that we do, the advocacy, takes time, but it does work. And we're moving ahead with this train, and we need everyone to do all that we can. These slides will be available to you. I want to invite everybody. We're having a third National Menthol Conference in Washington, D.C., close to where you are, September 20th and 30th. You can get information on it on our Saving Black Lives website, savingblacklives.org, and sign up. And so then I'm going to turn it back over to you, and then we'll take some questions, I think.
Thank you, Carol. That was really powerful. I feel like I could listen to you for the rest of the hour. Thank you. So we will pass it over to Matt, because he also has very interesting things to talk to us about. So thank you, Carol, and I will pass it to you, Matt.
Yeah, thanks, Diane. And I was just going to say, Carol's talk fired me up so much, I actually had to get up and like pace back and forth a little bit across my room, because I've heard you speak before, Carol, but every time it just blows me away, the tobacco industry's tactics. So hi, everybody. I'm just going to go ahead and share my screen because I've got a few slides as well. So stick with me for just a second. Okay. Can folks see that? I'm actually going to go to the beginning. All right. I'll assume this is good to go. So my name is Matt Wellington. I'm the Public Health Campaigns Director for PIRG. And if folks aren't familiar with PIRG, it's the Public Interest Research Group. We're a nonprofit, nonpartisan consumer advocacy organization that's been around for over 50 years. And our public health program really focuses on giving health professionals a megaphone to get their messages out to the public and to decision makers, and to equip them with ways to pass policies that will hopefully solve the health issues that we feel like we shouldn't have to tolerate in this country. And we have a very deep history of working on tobacco issues. We were quite involved in the no smoking zones. I remember when I was a kid being asked smoking or non-smoking going into restaurants, which just kind of blows my mind a little bit. And then more recently, we jumped back into working on tobacco control issues and have been supporting several state bills that would take flavored tobacco products off the market. And so I'm going to talk about how to engage in the FDA's public comment process and the value of doing that, and then also some ideas for how you can build a snowball effect from that first step of submitting a comment and help generate some broad visibility for this effort. So value of public comments. There's a couple reasons why you definitely want to comment in the official docket for FDA's rules, especially, rules, of course, that you care about and that you think will affect your communities. The first and the most direct one is that the agency takes those into account when they make the final rules. So this is a quote directly from someone at the FDA that when a consumer sends in a comment that's based on sound grounds, it can definitely make an impact and a difference on the agency's decision-making process. So, Joanna, when she was speaking earlier, I think did a really great job of showcasing how the tobacco industry will do everything that it possibly can to carve loopholes out of regulations and laws and continue to allow them to continue selling flavored products. So while the FDA listens to these comments, and we're encouraging everybody here to submit their own comments in favor of the rules, remember the tobacco industry is doing the same exact thing on the other side. So they're encouraging their representatives to submit comments, again, urging for either delays on these rules, carving out loopholes for these rules, or doing away with the rules altogether. And so it's really critical that we get a massive public support, so a lot of volume in the official comment docket for the FDA to see, but also that health professionals and experts dealing with public health or dealing with patients who have tobacco-related disease, or people who have family members and have that strong personal connection. We need that expertise in the official comment docket. And so again, the FDA, they will read these comments. It's part of the rulemaking process. They solicit public feedback, they read that feedback, and they have to account for those comments when they finalize the rules. The second value is this is really a litmus test for public support in a couple ways. So, I just looked at the docket on menthol cigarettes. I think it already has over 70,000 comments. I don't know how many of those are in favor of the rule, but ideally, most of them are, right? So when reporters and the media are covering this issue, which they certainly are, this is a really big deal for public health, that is part of the narrative. They want to know how much public support is there for this rule, and the comment docket is an easy way to look at that. So how many of the comments are in favor of the rule versus against? And of course, ideally, we have the vast majority in favor. The other way this serves as a litmus test for support is legislators, right? So there are legislators who they have the ability to really kind of muck things up for the FDA in this process. And so the comment docket is an opportunity for us to show that their constituents and the public at large is overwhelmingly in favor of the FDA moving forward on these rules, so that they, if they have the power, the legislators, if they have the power to really make an issue for the FDA on this, that number one, they don't do that, but ideally that they actually support the FDA in moving forward. Congress people can have an impact as well in encouraging the FDA to keep these rules as strong as they currently are and to swiftly finalize and implement them. So very important to engage in this public comment process. And then just some quick ground rules for public comments. So obviously you want to clearly indicate which side you're on. So I hope that everybody here would say that they're in favor of the rules. You want to include the docket number. In the link that we sent to the chat function for the group here, there's a lot of materials, one of which is template comments for both the menthol cigarettes rule and the flavored cigars rule that our friends over at Campaign for Tobacco-Free Kids drafted. That has all this information in it. So I encourage everybody here, if you're planning to submit comments, those templates are a great starting point. So you can start with those and then personalize them to be your own and submit them to the FDA. And then just some little things here when you're submitting your comment, if you're doing it as an attachment, just write "see comment attached" in the comment box, otherwise it won't actually get submitted. And as of now, the deadline for submitting comments is July 5th. So we've got a few weeks to go to generate more comments. And then what makes a good comment to the FDA? So I think the agency thinks of these in a couple ways. One is that they value evidence-based claims, right? So they're thinking about public health, they're thinking about science, they're thinking about law. And so any claim you're making should be evidence-based in your comment, and you should back those claims up with citations. So source your claims. They also see the comment period, that the FDA sees it as an opportunity to see how these proposed rules are actually going to affect people on the ground, people in reality. And so you want to demonstrate to them how this will affect either you personally or your friends and family or your community at large. Because they take that into account and I think really appreciate seeing those experiences. So a couple examples here, for me, I haven't submitted my comment yet. And when I'm drafting it, I'll probably mention the fact that when I was like 12 or 13 years old, I tried to start smoking. I was getting cigarettes from my next door neighbor. And it was thankfully disgusting to me. I hated the taste of it. They were just regular cigarettes. It was harsh on my throat. I remember coughing. And so what I'd say is, who knows what would have happened if my neighbor just happened to be a menthol cigarette smoker. If those cigarettes that I was trying for the first time as a 12 or 13-year-old had that, lessening of the harshness that Joanna had spoken about earlier, if it was numbing my throat and going down much smoother, who knows, I would have become a lifelong smoker. I don't know. So make sure you have that personal experience. If you're, a physician who's treating someone for tobacco-related illness, obviously you're going to want to talk about that without giving patients names, but how will this benefit your patients taking menthol cigarettes off the market? And then shorter is often better. I think that's the case for pretty much any advocacy writing that you're ever going to do. Shorter is better. Make concise points and drive them home with not too much of the statistics, but just enough to make your claims evidence-based. So the template comments that I mentioned are like 2 to 3 pages. I wouldn't really try to go much beyond that unless you feel like you really have a case to make in like 4 or 5 pages. Okay, building momentum. So there's other ways to build support and momentum for this rule beyond just submitting the comment. That's ideally your first step. One of the easiest ways is to take that comment and send it to your congressional delegations. So when you submit your comment to the FDA, send it to your congressional representative and send it to both of your senators with a note that you just wanted to make sure they saw that you're in strong support of the FDA's proposed rules, and that you hope that they will do whatever they can in their power to move the FDA along and finalize these rules quickly. The second thing you can do, and again, this is also in that link that Diana shared with the group, it's our health professionals letter that was drafted by our partners at the American Lung Association. So them and PIRG and several other health groups are circulating this broadly to the health and medical communities for individual sign-on. So please sign that letter. And please share it with your networks. We've seen huge amounts of success when folks share that with their colleagues, with their other health professional friends. They're a lot more likely to sign it if it comes from you, somebody that they know, versus me just randomly sending it to them, which I still do. But again, better response if it comes from someone they know. And that is going to be broad support from the health professionals and medical community on these rules, which will then publicize and also put in as a comment to the FDA towards the end of June. But again, that doesn't take away from you submitting a personal comment. You should absolutely do that, but also please sign this letter. And then the last thing, I'm going to start flying through this because I want to make sure we have time for questions. You can turn your comment into a letter to the editor or even an opinion editorial if you have time to submit to your local papers. And I'm going to have to skip a little bit of this for time's sake, but really quickly on writing good letters to the editor. Some people here might have already written opinion media several times. Some people, maybe you don't have experience with this. So for a letter to the editor, and this is the similar points to an op-ed, you want to make one clear point. So you don't have a lot of space for these. Letters to the editor are typically like 200 words. I try to stick to 200, even if the word limit for a paper is 300, try to keep it short. This is a great place to convey emotion, but again, avoid any hyperbole. So convey your personal experience, convey why you feel so strongly about this issue. And you can send that to your local paper's editors. It's great to respond to an article. So if you see an article about tobacco issues, you can go ahead and respond to it with your take on this issue. Or I think this is also just a really newsworthy topic. So I think you'd also have a shot at getting your letter printed just by sending it in as it is without responding to a particular article. And then just one really quick point. This is a great way to engage, not just with the public and get the message out to the public. People read the opinion section. It's also a great way to get it on the radar of decision makers. Legislators or their staff read these opinion sections. I co-wrote an op-ed with a physician in Ohio on COVID-19 not long ago. And maybe a week after the op-ed ran, the physician got a handwritten note from Senator Sherrod Brown from Ohio, thanking him for writing that piece and expressing his support for the measures that he was advocating for. So I don't think we have time to go through the full example that I was going to give because I want to make sure there's time for questions. So I will just end there. And again, all of the materials that you would need for both the template comments and signing that health professionals letter are in the link that Diane shared. And I hope you do it. Thanks.
Thank you, Matt. That was really informative. Thank you. So I am keeping an eye on the chat. If anybody has any questions for any of the panelists, that would be a good place to drop them. You can also put them in the Q&A. And I don't see any right now, but I had a quick question for Carol to maybe just get the conversation going. So Carol, you had mentioned preemption states, and I believe you mentioned that Maryland is one of those preemption states. So I was wondering if you could just talk a little bit about what that means and what the rules might mean for preemption states.
Certainly. So in a state that has preemption, it means that the state, there are levels of preemption. So there's federal preemption, that whatever's federally happening supersedes anything below it. And so some states, in order to block cities from where you might bump into your city council person at Starbucks and they have to look you in the eye, the further up you go, the more removed the politicians are. So the states set the laws for the cities and the counties. So Maryland is one of those states, and it's not just about tobacco, it's about other things. And a prime example is I also was working on soda taxes in California. So once we got Berkeley and San Francisco passed, the beverage industry came and did an end run, and they preempted any local legislation on soda taxes for a number of years. And they got our legislators to cave on that because they said they wouldn't fight anything else. They would let it go. But otherwise they would try to pass a law that cities couldn't do certain things. So that's a way that the corporations can control on a very higher level what is local action of people trying to protect themselves from, whether it's from Coca-Cola or from Reynolds Newport cigarettes. And there was some movement to change that in Maryland prior to COVID. Everything is before COVID and after. So because it's a coalition of public health people, not just tobacco, that were working to change it in Maryland in particular. And I don't know where that is right now, the status of that.
Thank you, Carol. Okay, I have one other question here. How can researchers support these efforts other than submitting comments? Matt, you gave us a few really great ideas. Or how can we work with the community, Carol, to further these initiatives?
I'm a big believer in community academic research partnerships. That's how I met Ruth Malone and Valerie Yerger. We worked on a community academic research partnership that was funded through TRDRP in California. So it's a marriage. It doesn't work with everybody. It takes certain people, but it really does. That project changed our lives, all of us. And it allows the community, it increases their capacity and also helps to make better research questions. So a lot of the research, we have a lot of research money because of TCORs and the federal money that's coming in. So we want research that's relevant, that's adding something, that it's advocacy. And so in the beginning days, the industry talked about the science, where's the science going to take us? So when the science takes us to take menthol off the market, then we're not going to pay attention to that anymore. So really working with the community to develop relevant research questions that are going to move the agenda forward, and not just doing research for research's sake because it employs people and it's interesting. A lot of research is just interesting, but there's no there.
Yeah, I can chime in really quick. And then I just saw an interesting question pop up in the chat. So there's definitely been moments where, to Carol's point, like doing practical research, when we've been working on state bills, all these questions come up where we're thinking, oh, it would be great if we knew this particular statistic, or it would be great if we had messaging research on this particular thing that lawmakers seem to care about. So I think being rolling with the punches, so to speak, if you're engaging in a campaign, I would love to have a research person in our coalitions who we can turn to and say, hey, we need to find the statistic because this lawmaker, for whatever reason, really cares about how, flavored cigars are affecting this particular community or this group of people. So that's one quick thing. And then I would just say the research that you do, get those results out there to the public and decision makers. Don't sit on that and assume people will read it, because I hate to tell you they won't. So you have to do the work, the advocacy work, to get that into the right people's hands. And folks like me and Carol and others, we can help you with that. So get involved with one of the groups working on this, and we'll help maximize the research you're doing and the skills you want to learn to make a difference on these issues.
Definitely. And I just want to second that, to be proactive. If you have something, reach out, don't wait for me to read it in the journals. Reach out to us and say, we've got some ammunition for you, because research is our ammunition. And that has, the research done with the tobacco industry documents, the research, we need that, but we need it to be relevant, and reach out to us early when you know something's coming, because we are so busy, we need help. So when you know something good is coming, get us in the loop so that we can start preparing of how we're going to use it. And that also helps your career, because we're going to get some media around it. We're going to get some webinars around it and get it out to the public, get it out to the community.
Great, thank you. Okay, so we had an interesting question in the chat. I think maybe this is the one you're referring to, Matt. Are there any concerns about loopholes on menthol tobacco products on Native American reservations? I imagine there are.
Yes, yes,
I'm not sure
are.
who is the right person to take that question.
Well, we do a lot of work with our Native American brothers and sisters, and California, we have a lot of reservations out here in places where cigarettes are sold. And so this, back to that self-determination and capacity building. So Patricia Nez Henderson got some laws passed in the Navajo Nation. And so, it can be done. It must be done respectfully, and we must engage our Native Americans as the entities, the sovereign nations that they are. And we're going to be doing more work as African Americans and Native Americans, getting our kids together and taking on American spirit. But the whole issue of, the loopholes and the spots where these products will be sold, we're going to have to address that in a respectful way, nation to nation, and having the correct people at the correct level approach the sovereign leadership of the reservations.
Okay, so this is a little bit of a longer question. It's for Joanna and Carol, but anybody can answer. Do you think that the last element of the proposed rule that says no person may manufacture, distribute, etc., rather than no commercial establishment, creates exposure for those that invoke the Eric Garner problem?
Yes, I do. And I'm learning from your presentation, Matthew, because I've been too busy. Valerie and Phil have read everything, but I have not. So we're going to be dissecting that. We have some other issues with it, because they can still make these products in the US, they just can't sell or distribute them. So we don't want them to be made in the US either. So those are some things that we should address when we're sending in those comments about the rulemaking process. So we're watching over this process. We still are formulating our thoughts and comments on them. But I would say, yes, that is an issue of concern. And I will be looking into it more as we are really digesting everything and getting the game plan out to the community.
Yeah, and I agree. Yeah, I agree, Enid. I was surprised to see that, because that is sort of a concern. So depending on what as Matt said, the most important points you want to make, that might be something that people might want to raise. Because again, I think the idea, the FDA has talked about, they don't want to criminalize people for possessing these products, but you're absolutely right. And so there are situations where individuals might be selling like a single stick or a single cigar to other people, and we don't want to criminalize those people either. They're not the ones manufacturing the products. So we do want to be careful with that. So thanks for raising it.
And I think we have another question for you, Joanna. I know you can see it, but I'll read it for everybody in the audience. Bans often trigger compensating behaviors from industry and individuals. In Canada, smokers shifted to menthol cigarettes from First Nations, where menthol bans do not apply. Do we need to worry about the risk of an illicit market for menthol cigarettes emerging in the US? That's a good question.
Yeah, great question. And it touches on Mike's question as well about whether Indian Territory is covered or not. And I did a quick search of the rules, and I did not see that addressed, but we'll have to look a little, be worth exploring that. So yes, some people switch to illicit products, but at the same time, a lot of people quit altogether. Like I think it was about a third, which is significant because we know that nicotine is addictive. The behavior is, the behaviors are hard to change. So you might expect that if menthol cigarettes were not on the market anymore, you might switch to a regular cigarette. But we saw a third of people quitting altogether. In Canada, and even among people who were living actually pretty close, within distance of areas where tribes are legally able to sell products. And then also one of the problems was in Canada is that it didn't apply to all products. And some people switched to flavored and menthol e-cigarettes. So we just have to be, you can't squeeze the balloon in one place because it's going to expand in another. And that's why I said it's really important to be comprehensive and to anticipate what people might do, but also how the industry facilitates different options. So I think, illicit is one option. People are going to some people are going to want to try and find the product that they've been using and that they're addicted to. But I think I'm really encouraged by the proposed rule that they are trying to address accessories and component parts, including what we've seen, flavor cards, drops, capsules, but there's going to be the next thing. So what you don't want to do is limit to those specific products, those specific accessories, and make sure that the wording it's inclusive of those things, but it would apply to other types of accessories too that probably don't even exist at this point. So, but thanks for the question. It is important. Some people are, if illicit products are available, some people are going to resort to them, but I think if we can be as comprehensive as possible, we'll minimize that.
Yes, and the other thing is that we are, when I'm out doing presenting, I'm not advocating that Black folks switch from mentholated to non-mentholated. It's about, we're playing what we call the end game. And that's a movement that's growing around the world to phase out the sale of nicotine products, of addictive nicotine products. So this is part of the big picture of working to change hearts and minds and to get the public to understand that we can in this, and that we're not going to just keep chasing the industry for the latest, newest thing. So hookah is huge now in the Black community all across this country. And hookah was exempted from the California law that we are working to keep in November. So that's, the next frontier, but we want to end this. And so, there's cities and states that are doing that. Beverly Hills and I think Newport Beach do not sell tobacco products at all in their city anymore. New Zealand is our model for a country. And so there are different ways to get there, but that's the game that we're playing, is the end game. And we're formulating in California, we're working very hard on formulating the framing of that and phasing it out, and for people to understand, to interrupt the addiction cycle. So we have the people already hooked, and we've got to help them, but then we've got to have a fire line and break the cycle of addiction for our children, for our young people. And so that's the big game that we're playing, so that we're not spending the rest of our lives chasing the industry who's just gonna, morph and reinvent itself and come up with something new.
And I just want to really emphasize that there's always going to be some risks, and I think it's about weighing public health benefit. So you can poke little holes in different laws and policies and whatever that come out, but the public health benefit is, if it's overwhelmingly a public health benefit to the community, we should do it. As Joanna was talking about with Canada's menthol regulations, that did result in, I think, an overwhelming public health benefit, even if there were some folks who ended up moving to different products or illicit markets. And then the message, right, is that what Carol just said, it's about preventing the next generation of tobacco users. And so right now, the menthol cigarettes proposed rule is one of our best shots at doing that. But all of us on this webinar, like Carol, Joanna, myself, we would love to see no flavored tobacco products at all, right? So it's not the ideal way to go about it, but this is the reality we're in, and it's a public health benefit overall. So we're pushing forward to get these rules finalized. But we're also, PIRG's working in different states to pass laws that will take all flavored tobacco products off the market. I know someone asked about menthol flavored e-cigarettes. We don't want menthol flavored e-cigarettes because people are, if these products are there, the tobacco industry will absolutely take advantage of different products, create new products. And so that's the long term.
And the attorney generals have sued Juul. And so that some of those lawsuits are coming to fruition. So North Carolina was one, and they left menthol Juul on the market. And so we don't want black smokers switching to menthol Juuls. They have a very high nicotine level, twice as high as what's sold outside of the US. Nicotine increases your blood flow and constricts your arteries. So that's stroke and, cardiovascular issues. We want people off. And so we don't want the experiment in real time of whether e-cigarettes is less, only kills 25% of the people that use it instead of 50%. That's not harm reduction. And so we want Juul off. And so there are folks on this call that might have some influence over some of the attorney generals. And North Carolina, the other states that settle after North Carolina will automatically go to the best law and the best protection and the best money that was received for public health. So we don't want menthol vapes on the market as something that we're going to steer African American smokers to. We want people to quit, and we want the resources put in and the targeting for public health the same way that we were targeted for ill health and racistly targeted.
Yeah, I'll just add, these are fantastic points. And I do want to emphasize what Matthew said earlier, is that the key point in responding to the rules in the docket is to say we're in favor of these actions. That's the big picture. So these other things are points that come after that, and they're important, but not like the big thing is we have to move forward with the bans on menthol and the flavors, ban and flavors in cigars. So it's really key to emphasize that you're supportive of these rules, and then if you want to add and other things you could consider, but make sure to be clear, because what you don't want is for the FDA to get cold feet and then not move forward at all.
Great, thanks for that, Joanna. Yeah, a lot of great points, a lot of great questions. Thank you everybody who submitted a question. I think we'll wrap up there. But again, we've shared this link in the chat a couple of times. I encourage you to visit the link. There are a lot of resources. There's a webinar from the FDA about the rules. There is a link for where you can go to submit comments, and Matt has shared a lot of really great resources for how to create comments. And so I encourage you to check out that information. We will have this recording on our website. I think we will also send it out to everybody who registered for the event. And so you can feel free to share that with your colleagues. We will also have these resources on our website. And I would just like to thank each of you again for joining us. This was really informative, really powerful, and it was great to hear from each of you. So thank you. And thank you everybody for attending.
Thank you.
Thank you.
All righty. And I'm going to put a link to Matt. There's your resources on our webpage too. It's excellent.
Great.
Okay. Thank you.
Thank you.
Everybody.
All right.